Here is a detailed explanation of fluorescence in situ hybridization. NARB 1. Introduction. Fluorescence in situ hybridization, FISH, is a powerful molecular cytogenetic technique used to detect and localize the presence or absence of specific DNA sequences on chromosomes. It is widely used in genetics, oncology, and prenatal diagnostics to identify chromosomal abnormalities, gene rearrangements, and other genetic mutations. Definition. FISH is a laboratory technique that uses fluorescent probes that bind to specific parts of a chromosome or DNA sequence. It allows for the direct visualization of genetic material under a fluorescence microscope, helping in the detection of chromosomal abnormalities and gene mutations at the DNA level. 3. Indications. FISH is indicated for diagnosis of genetic diseases, detection of chromosomal abnormalities in cancer, prenatal screening for aneuploidies, e.g. Down syndrome, detection of gene fusions, e.g. BCR-ABL in chronic myeloid leukemia, monitoring minimal residual disease in cancers, identification of sex chromosomes and ambiguous genitalia. FISH is used for identifying structural chromosome changes, deletions, duplications, translocations, detecting gene amplifications, e.g. HER2 in breast cancer, cancer diagnosis and prognosis, determining chromosomal makeup of embryos in IVF, genetic counseling and family planning, research in gene mapping and chromosomal studies. 5. Why do this test? Need of this test. The FISH test is needed to identify chromosomal or genetic anomalies early, guide appropriate therapy, targeted therapy in cancer, predict disease progression, confirm findings from other tests like karyotyping or PCR, provide prenatal diagnosis of genetic disorders, clarify ambiguous clinical diagnoses. NASHNAR 6. What happens during the test? During the FISH procedure, 1. A sample of cells is collected, blood, bone marrow, amniotic fluid, or tissue. 2. Cells are fixed onto a slide. 3. Fluorescent-labeled DNA probes complementary to the target sequence are added. 4. The DNA is denatured, separated into single strands. Probes hybridize, bind to their specific sequences. 6. Excess probes are washed off. 7. A fluorescence microscope is used to view the labeled chromosomes or genes. Each color represents a different gene or chromosome region. 7. How long for my results? Preliminary FISH results, 1 to 2 days. Full detailed report, CHA 3 to 7 days. Time may vary depending on the sample type and reason for testing. 8. Prepare for this test. Preparation depends on the sample type. Blood sample, no special preparation. Amniocentesis, prenatal, follow doctor's guidance. Tissue biopsy, may require local anesthesia. Bone marrow aspirate, usually done under local anesthesia or sedation. General instructions, inform your doctor of any medications or health conditions. Consent may be required for genetic testing. 9. Risk. FISH itself is not risky, but the sample collection may carry some risks. Blood draw, minor bruising or discomfort, bone marrow biopsy, pain, bleeding, or infection risk, amniocentesis, small risk of miscarriage, tissue biopsy, infection or bleeding. 10. Normal values. FISH does not have normal values in the traditional sense. The results indicate presence or absence of a genetic abnormality, a normal FISH result, expected number and arrangement of chromosomes or genes. Abnormal FISH result, deletion, duplication, rearrangement, or fusion of genes. Number 11. Interpretation of results. Positive result indicates a genetic change was found, e.g. HER2 gene amplification in breast cancer. Negative result, no genetic abnormality detected. Equivocal or inconclusive, may require repeat testing or other tests, e.g. karyotype, PCR. Interpretation is done by a specialist in genetics or pathology based on fluorescent signals, pattern and intensity of probe binding, clinical correlation with symptoms. Number 12. Factors affecting results, quality and handling of the sample, type and specificity of the probe used, technical errors during slide preparation, mosaicism, mixed cell populations, genetic polymorphisms, incomplete hybridization. Number 13. Clinical significance. FISH has major clinical importance. Cancer identifies chromosomal changes critical for diagnosis, e.g. BCR-ABL in leukemia, ALK rearrangement in lung cancer. Genetic syndromes detects microdeletions like DiGeorge syndrome, 22q11.2 deletion, Prenatal testing screens for aneuploidies, e.g. trisomy 21, 18, 13. Therapy guidance. HER2 positivity predicts response to trastuzumab in breast cancer. Prognostic tool. Helps predict disease course and tailor personalized medicine. 14 no more probes can be gene-specific, centromeric, telomeric, or whole chromosome painting probes. Types of fish. Interphase fish, no need for cell division. Metaphase fish, needs dividing cells. Q-fish, quantitative. Multiplex fish, multiple probes used simultaneously. Fish can be combined with other techniques like karyotyping, microarrays, or NGS for comprehensive analysis. And 15. Conclusion. Fluorescence in situ hybridization, FISH, is a versatile, accurate, and rapid molecular technique used to detect specific genetic alterations in both research and clinical settings. Its ability to visualize chromosomal and gene-level changes directly within cells makes it invaluable in diagnosing cancers, genetic disorders, and prenatal conditions. Understanding how and when to use FISH enables better disease diagnosis, prognosis, and treatment decisions. Thank you. Have a nice day.